So that way,
We won't be
okay,
looking to
yeah,
the
we won't be
okay.
looking over there. Yeah, okay. 7:20, you appear here. Okay.
Yeah.
Yeah, I think we'll go. Yeah.
Yeah.
Okay.
Hello, everyone. Today we're going to talk about something important: dental health. It's important. It's something that matters to all of us. I'm Amber, and I'm excited to be the host of this live show. We've got a great show lined up. We'll be talking with Dr. Kumar Vadivel, also known as Dr. V. He's a super smart dentist who knows a lot about teeth. He's going to tell us about the new things in dentistry, how to keep our teeth healthy, and the ways how to get dental care that doesn't cost too much. Whether you know a lot about teeth or just want to know how to keep your smile bright, you'll find something interesting here. We'll cover many topics like why brushing your teeth is important and what's new in dental technology. We've already got some questions from you, our viewers, and we'll answer them. Plus, you can ask more during the live show. Before we start, let me tell you more about Dr. V. He's not just any dentist, he's a periodontist, which means he's an expert in certain types of dental care. He works here at ToothHQ Dental Specialists in the Dallas Fort Worth area here in Texas. And guess what? He's writing a book that's going to be coming out next year. If you want to know more about Dr. V, check out our website at mytoothhq.com. So let's get comfortable and ready to learn lots of cool stuff about taking care of our teeth. Let's begin our live dental show. Welcome, everyone. And now let's welcome Dr. V.
Thank you
Let's start
very
the show.
much. Yeah,
Thank
thank
you.
you. Hi, everyone. I'm Dr. Kumar Vadivel, but you can call me Dr. V, like Amber said. I'm really excited to be here with you all today. Another great show. I'm super excited. Let me tell me a little bit about yourself again. I'm a board certified periodontist, which means I'm specially trained in taking care of gums and the bones that support your teeth. I'm also skilled in dental implants to replace teeth and oral surgery. I'm a part of the American Academy of Periodontology and the American Board of Periodontology. That's just a fancy way of saying I work with a group of dentists who are experts in gum health and replace teeth with dental implants. I started ToothHQ Dental Specialist, and we have four offices in the Dallas Fort Worth, Texas area. We are all about making sure that your teeth and gums are healthy and strong. Now, I'm here for you. I would love to hear any questions you might have about your teeth and gums, and you can ask us questions live right now or even send them in for our next show. Your questions help us make these shows really helpful for not just for you, for everyone. And one more thing, if you like what you're learning here, please let us know. Your feedback is super important to us. Don't forget to like, subscribe to our channel so you don't miss out on the latest updates and helpful tips for your dental health. I'm so looking forward to talking with you all and answering your questions or any questions, and let's make our smiles the best they can be. Let's get started.
All right,
Yeah,
Dr. V.
yeah.
So, the first question that a lot of people have been asking is, can you please advise me on how my 3 year old's thumb sucking habit can be affecting his oral health?
So there are many things that the thumb sucking can do. Not thumbs up here, thumb sucking we are talking about here. So number one, misalignment, meaning we call it as a malocclusion in dentistry. So it is going to completely make your teeth crooked, and believe it or not, when it is going to make your teeth crooked, it is going to cause speech problems. People kind of lisp, and if you
Yeah,
notice, right,
that's true.
because the teeth are going to be wide open, they don't come together like this. They're going to be open, and people start to lisp, and because you are going to put constant pressure with the thumb at what we call as the roof of the mouth up there, it is going to make some changes in the roof of the mouth, particularly when the children kind of develop and in the developing age. So number three, it is going to cause changes to the roof of the mouth. And the number four, and believe it or not, again, because the child is constantly sucking on the thumb, and sometimes they accidentally bite the finger, and it is going to cause injury to the teeth. So, long story short, crooked teeth, speech problems, changes to the roof of the mouth, and thumb sucking, injury to the thumb.
Wow, that's quite a bit.
Mm-hmm.
All right, the next one. Hello, Dr. V. I'm planning to get implants for my upper teeth. Will dental implants have an impact on my adjacent teeth?
Absolutely not. So the dental implants, we call them as the closest replacement to the natural teeth. They look, function, and feel like natural teeth, and so they do not absolutely cause any harm or any damage or anything to your adjacent teeth at all. And they are going to look closest to the replacement teeth and look so natural.
They really do. Yeah.
Mm-hmm.
I recently came across a Facebook promotional for $1,000 off on laser gum treatments at ToothHQ. Could you please provide more details on the type of laser procedures you offer under this promotion?
Great question. So you do this every day,
I
don't you?
do. I
Right?
do.
So,
Yeah.
so tell me, like, what are the two things when patients have gum disease or periodontal disease?
Mhm.
What are the two types of treatments that we normally offer to them?
We're going to offer them a deep gum therapy
Laser
with laser
assisted,
assisted,
right?
and
Okay,
then or osseous surgery if it's
right.
a very advanced
Which
case.
is the laser gum
The
surgery,
laser
right?
gum surgery.
So, as Amber said, people when they have periodontal disease or gum disease, there are two types of treatment that we offer. When they have what we call it as an early or mild to moderate periodontal disease or gum disease, they need deep gum therapy, laser assisted deep gum therapy. Or when they have, particularly if they have already gotten the deep gum therapy and that did not work well, and when they have advanced gum disease, we offer the laser gum surgery. So there are two promotions, and I believe the it is available on the website. The one that you are particularly talking about is that does apply to the advanced laser gum surgery for mouth. But I believe there is another coupon available. So whatever that you see, and this is what we say because we run a variety of promotions to help our patient throughout the year. So whatever promotion that you see, bring it to us, and as you might also see that we also offer a free consultation and free CT scan or a CAT scan for all our patients. So come see us, whatever promotion that you see, bring it with you and we'll take good care of you. Isn't
We
that
will.
what you do?
That's what I do every day, all day.
There we go. Amber, she may be, she or not, she may be, she will be the smiling face, and make sure to ask for Amber so you can see the exact smiling face here. Okay?
Yes.
Yeah.
All right. Is oil pulling effective for oral health? And if so, what type of oil should I use? That's big on TikTok. So,
Oh,
yeah.
there we go. Right. Okay, great we go. All right. So, let me share for those people who may not know what oil pulling means. So, oil pulling is an ancient form of an Ayurvedic. You know, Ayurvedic comes from India, where I come from. It is an ancient form of an Indian treatment for treating some type of oral diseases. So, what does this oil pulling do? So, the oil pulling offers a variety of benefits, and the best oil that we have seen, although people use a variety of oils and depending on which part of the world they are located, what we see the most common is the coconut oil, which is a very popular choice, and because of it is pleasant taste and
Mhm.
also because of the antimicrobial properties. So particularly if you are using any type of oil pulling, you may be thinking that you may have some type of infection in the mouth. So when you use the coconut oil, not only it helps you with the pleasant taste, but also it helps with the antimicrobial properties. The second most common oil that we see is the sesame oil, again, which is very traditionally used in the Ayurvedic medicine. for oil pulling. And then the third one is the sunflower oil. Again, another oil which has great potential benefits for oral health. So number one, coconut oil. Number two, sesame oil. And number three, sunflower oil. So that doesn't mean that you cannot do the oil pulling with other oils of your choice. Try that. But if that doesn't work, then try these, what we recommend.
Great.
Yeah.
All right. I'm a 40-year-old male. 2 months ago, I had all four wisdom teeth removed. Since the extraction, tooth has been getting stuck between the first and second molars on both sides of my upper teeth. Could this lead to bone loss? If so, what should I do to address it? Please help.
Okay, so after the removal of the wisdom teeth, if you're particularly noticing food packing, I want to make sure that I answer your question right. You said the food has been getting the food has been getting stuck between the first and the second molar.
Correct.
So when you say a first and the second molar, we are not talking about the back of the second molar where you actually got the tooth removed from. So we are not talking about a wisdom tooth problem here. It is not because you had the wisdom tooth removed. And more than likely, you probably, even before you got the wisdom tooth removed, you probably had this problem of the food getting stuck in between the second and the first and the second, first and the second molar. Yes, the first and the second molar, which is a completely different problem than the wisdom tooth. So I'm so glad you already got the wisdom tooth removed, because that can again contribute to the gum disease. So if you already got the wisdom tooth removed, now you have to address the food packing between the first and the second molar, because what we normally say is we call them as contact. So the teeth need to be tight like this. Can I borrow your hand? Do it like this for me. So when the teeth, do it like that.
Okay.
Okay, so when the teeth are tight, so when the food goes in between, the food kind of deflects away. So when the teeth are not tight, show them like this, right? So when the teeth are not, so when you bite down, the food kind of goes down. So it hits the gum tissue like that. So you don't want the contact to be open. So that's why it is critical. You need to get that checked out. Again, talk to your dentist to see whether you have an open contact between the first and the second molar, which may be causing the food packing. And if so, then the dentist can do some adjustments, either a filling or maybe a crown, or maybe even do some braces to bring the teeth together. And and again, make sure they attend the gum disease, and this is going to prevent the food from packing and prevent any type of bone loss or gum loss, and eventually the tooth loss or even cavities and such. So talk to your dentist, or if you happen to be in the Dallas-Fort Worth area, come see us, and we can help you at ToothHQ.
Definitely. All right, next one we have. My dentist informed me that I have stage 1 periodontitis and recommended that I consult a periodontist. Could you please explain what stage 1 periodontitis is, and how, and also can this condition be cured completely?
All right. So it is a two-part question. So what is stage one periodontitis is, and there could be several classifications that could be available to define what a stage one or a stage two or a stage three periodontitis. It all depends on the degree or the severity or the progression of the disease or the condition of your gum and the bone and the tooth, right? So what normally whenever we look at the status of the tooth to evaluate the periodontal disease, we look at what we call it as the pocket depth, and the status of the gum, status of the bone, and whether the tooth has any type of mobility, or like the tooth is kind of mobile. So those are the things that we look at. I may be calling it as a stage one, and if you go to somebody else, then they may be, oh, because you are between a stage 1 and stage 2, somebody may be calling it as a stage 2. So between stage 2 and a stage 1, stage 2, there is not like a major difference, but maybe stage 3, when you start to see the tooth kind of mobile and it is kind of really advanced. So no matter what it is, so you definitely have periodontal disease, which means you have some gum loss and the bone loss. And no matter whether you have stage 1, 2, or 3, it needs to be addressed. So you need to probably have some type of either a deep gum therapy or a laser assisted gum therapy, or gum surgery or a laser assisted gum surgery. So definitely see a periodontist. And then the second part of your question is whether the periodontitis is curable, right?
Yes.
For the most part, we say whenever a patient gets gum disease, and the patient always is going to have gum disease, right? So for example, we talk to our patients about this all the time. Whenever you have diabetes, very rarely it is completely curable, and you can always get the diabetes under control. And when you get everything under control, and when it is fully controlled, you're almost close to, or almost like a normal healthy person, as if you do not have diabetes. The same thing. So whether you have gum disease or not, as long as you get everything under complete control, you are just like anybody else, and you have any healthy person with a healthy mouth. So don't worry about what stage you are in, what stage of periodontal disease you are in, and whether it is curable or not. Go see a periodontist or a dentist, and they should really be able to help you.
Yeah, to get their gums back to a stable level.
Bingo.
Yeah.
Bingo. Right.
Okay.
Yeah.
All right. My 10-year-old daughter is scared of dental visits and she needs braces. How can I make this experience easier and less stressful for her?
So great question. And let me share with you, you're not the only one. There are many people on the same boat as you. So if you're really concerned about, if you're after seeing all the hardware, or I call it the metal industry in the mouth, right? If you're thinking of the hardware, which is going to be very painful, there are many means. It can be a pleasant experience. So talk to your dentist or the orthodontist. See whether you are a candidate for invisible braces. The invisible braces are as simple as like a tray like this. Look at that. This is not a metal industry in your mouth, and this is not a hardware in the mouth, and it is removable. So if you feel like during the process, or during the initial term, you need some time, a little bit of time to get adjusted to make it comfortable for you, talk to your dentist about Invisalign or any type of clear braces is an option for you. So you don't have to worry about wearing these metal braces all the time. And nowadays, with all the technology, including artificial intelligence, we got great ways to deliver comparable results just using these clear braces or the Invisalign type removable braces, compared to the traditional wire type braces. So talk to your dentist or the orthodontist, and they should be able to help you.
Yeah, that's great. All right. Hello, doctor. I'm a 39-year-old male and a smoker. Hmm. Could you please recommend a good dental insurance plan for me?
Why did you say, huh?
Well, I mean, I think he needs to be focusing on the smoking first.
Right. So
More than
exactly.
yeah,
Right.
dental
Yeah.
plan. Yeah.
Perfect. Yeah. Okay. Yeah. So just like Amber said here, right? So one of the main reasons why you get periodontal disease or gum disease, it's because you smoke, right? Um, and smoking not only causes periodontal disease or gum disease, it causes cavities, it causes dry mouth, and I don't have to tell you about other health problems like lung problems and cardiac problems and all of that. But anyway, long story short, and you are a 39-year-old smoker, and what is the best dental insurance plan? any dental insurance plan could be good for you. So if you if you work for an employer, and talk to your employer, and your options are going to be whatever your employer is offering. And if you have private insurance, so talk to the marketplace, or talk to the marketplace agent, or look at your marketplace to see what they have to offer. And then if you have a choice of two or three plans, and if you have a dentist that you have a relationship with, and ask them whether they can help you pick a plan or not. So depending on the condition of the mouth, and a lot of times these dentists can offer sometimes free consults like we normally do
We
at
do.
ToothHQ, or they can offer a consultation at a very nominal cost. So after you choose your plan A, B, or C, and take all those three plans with you to check with them to see what will be the best plan based on your condition, and they should be able to help you.
Yes.
Yeah.
And then stop smoking. That would be
There we go. Yeah, thank you.
Yeah.
Thank you so much.
All right, so we
Right.
do have a live question coming through.
Oh,
The first one is, I am deaf and would like to know the best way to communicate with you regarding a teeth implant. I'm assuming she was more because it's teeth. Um, would it be possible to communicate via text or through a Zoom call with an ASL interpreter?
um,
It's a great question.
it is absolutely a great question. Can you communicate with us with via text? Absolutely, we do. We help our patients all the time via text, and we are very big in technology. So we can definitely help you. However, our help that we could offer is going to be limited, because we can do so much on the text, but at some point we need to start talking to you, and you definitely are going to need an ASL type interpreter that we really need to be talking at the time of the consultation. And we are a small business, and we are not like a large hospital.
Mhm.
So we are not equipped with bringing in an interpreter to our office. So normally when we have patients who are going to need like a lot of help, not just the ASL type interpretation. So we have many people from many different countries, and so if they need interpreters, and we normally work with the UT Southwestern Hospital. So how can we help you? So send us a text and tell us or explain to us what is your problem and what type of help you need. And you already mentioned that you need a dental implant. Let us know, and what is your expectation, and put your information on our text, and then send a text, or even go to the Dental Dilemma's website and then submit your information, and we can initiate a referral to UT Southwestern. You cannot be seen without a referral at the UT Southwestern Hospital, but we have special relationship with the UT Southwestern oral surgeons and the dental department. We can make the referral for you, so you can be seen, whether you need an ASL interpreter or people who may need another type of language interpreters, and send it to us, and then we can take care of that for you.
You sure can.
Awesome.
All
Awesome.
right. Okay, so our next question is, my dad lost 7 teeth before turning 50, and this has me concerned about my own oral health. Does genetics play a significant role in our oral health?
Um, the short answer is yes, right? So where does the genetics does not play a role, right? Every single heart disease, lung disease, gum disease, cavities, every single thing, genetics absolutely play a role. As a matter of fact, before I came from the Cedar Hill office today, uh, we had a very young beautiful lady, got beautiful teeth, everything looks great brushing, and keeps her teeth absolutely healthy, but she has the seeding all the way down. So, and we're talking to her about, hey, whether you grind your teeth or did you have braces, and she absolutely not. She does not have any of those risk factors at all. So the only thing that I can think of is could be possibly genetics. And then I did ask her, hey, I do not see any type of risk factors in your mouth. You seem to be brushing and flossing, and you didn't have any brushing and flossing really well. taking care of your teeth and seeing the dentist every 4 to 6 months, and ever since your childhood, and you do not smoke, or you do not use like a lot of other the alcohol or anything, and why do you have this? The only thing that I can think of is the genetics. And then I did ask her, hey, do you recall whether your mom or dad lost their teeth at a very young age? And then she said, absolutely. All my family members, my mom and my dad and my grandpa and grandma, all of them lost their teeth at a very young age. And then that kind of explains to the reason why she had some receding gums or the gum recession. She actually came to the office, told us, oh, I have gum recession, right? So it's just funny that happened just today. So to long story short here, absolutely genetics plays a big role in the dental disease, including periodontal disease or gum disease.
That's true. All right. So, hey, Doc, can wisdom teeth extraction affect the alignment of my other teeth?
Um, This is not an uncommon question. People normally ask, wisdom teeth are the last teeth in the mouth, right? And people ask us, oh, once I remove the wisdom teeth, are my teeth going to shift back? So normally what we say is the wisdom teeth are not the wisdom teeth, are the teeth in front of the wisdom teeth, which are the second molars. Wisdom teeth are normally we call them the third molars. So the second molars have some type of memory to not to go back. They always go forward after the wisdom teeth removal. So when you remove the wisdom teeth, um, just get the myth out of your mind that the teeth are going to shift backwards, because once you remove the wisdom teeth, the second molars are going to either stay put normally like a stand. They are going to stick together. They are going to stand like this, or they are only going to lean forward. So that means it is not going to misalign your teeth, or it is not going to make your teeth crooked.
Okay.
So have the confidence, get the wisdom teeth out. They're more than likely always a problem. Get them out when you're young and healthy and be done with them.
Definitely. I had mine out when I was 16.
There we go.
Yeah.
I got them out late actually. So when I was in England is when I had my wisdom teeth out. I believe like I was around like 25 or 26. So when I had them out, I actually had 5 wisdom teeth.
5? So
I
you
did.
had a lot of wisdom.
I had, of course, man. Like, what do you think?
I guess.
Right? Do you know the maximum number of wisdom teeth I had removed?
No.
Guess.
All of them 5?
But no. I said I had 5 wisdom teeth,
You have
right?
5.
So tell me what is the maximum number of wisdom teeth that I've removed for a person?
4.
No, I
you?
said 5. I had
5?
5. Yeah. So what is the maximum number of wisdom teeth I've removed at one single visit?
5?
No.
No, how many?
Keep going.
10?
Keep going.
In one visit?
One visit.
Person?
One person. Yes.
No.
Yes.
32.
No. 13 wisdom teeth is what I have removed. Yeah, 13. So what that means
That's
is
crazy. They
yeah.
had them all up. How was
Well,
it?
just around the tooth, right?
Huh.
Around the tooth. So around the wisdom tooth, what we call it as a supernumerary teeth.
Oh.
Yeah.
Okay.
So either you call them fourth molar or the fifth molar or the
13?
sixth molar. So I removed 13 in one visit. They're not like big teeth. They're like kind of tiny weeny teeth.
Yeah, they're little bitty teeth, but still, that's
13.
crazy.
Yeah. There we go.
Huh, I've
Yeah.
never. All right. So, how is LANAP different from other laser gum surgery?
So in our office, we offer multiple laser gum therapy, and this is a very common question that gets asked. What is a LANAP procedure? LANAP is a form of an FDA-approved periodontal procedure. What with the LANAP procedure, what we normally see happen is LANAP is a form of what we call it as a non-invasive or a minimally invasive gum treatment that we offer. Particularly, we keep the gums closed, and then after we pass the laser around, we go under the gum line and clean out all the tartar. Particularly, the Lanap works really well when you have like a lot of disease and when you have bone loss, and then when you have what we call it as a lot of scar tissue from the gum disease. That when the gum damage or the bone damage happens, there is a lot of scar tissue. So the Lanap works really good. So after we pass the laser, we do the deep cleaning, and again we pass the laser all the way to the gum, all the way to the bone. So the great thing about the Lanap procedure, the way if it is properly done, this is what we do all the time here. If it is when it is properly done, so the Lanap is going to help regenerate the bone and the gums, and then we also call it as a cementum. Cementum means it is a layer on the tooth surface that helps attach the bone and the gum to the tooth surface. So with the Lanap procedure, we are able to a lot of times regenerate the bone and the gums and the cementum. So that's the difference between the Lanap procedure and the other laser procedures. Um, Depending on who you talk to, your dentist may or may not be able to give this information. A lot of times, the periodontist or the gum specialist should be able to give you that information. There are similar procedures that are being offered by other machines which are equivalent to a Lanap. In our office, we use a machine called, in addition to the Lanap machine, we also have another machine, it's called BioLace. They offer something called repair. So a repair procedure is similar to the Lanap procedure. So we'll definitely can talk to you about, like, if you happen to be in the Dallas-Fort Worth area, come see us, or talk to the dentist in the area or a periodontist in the area who can offer that for
That's
you.
true.
Yeah.
All right. What type of toothbrush and toothpaste is best for my 4-year-old child?
All right. So the there are multiple things that could offer. Any kid toothbrush should be able to get. We got Oral B kids toothbrush, and we got Sonicare kids toothbrush, and we have some Brush Ease kids toothbrush, and these are all like great toothbrushes. And then the toothpaste, like anything with the fluoride in them, is what we normally recommend. But sometimes kids have a tendency to have some type of allergies, and then we get Tom's of Maine toothpaste. You can go to Amazon and then you can look for it. Amazon Tom's of Maine toothpaste, that is a great one. And then if your kid has a tendency to swallow the toothpaste, again, pick something that does not have a lot of fluoride, so there is not like a lot of fluoride ingestion.
Gotcha. All right. Hi, doctor. Is it okay to remove 6 teeth all at once?
Absolutely, all the time. Six, and how many maximum you remove it out of?
32.
32, all
All of
32
them.
at the same time. So absolutely, it is completely okay to remove all 16 at once.
All right. An apple a day keeps the doctor away. So what keeps the dentist away?
I think you can say that.
Maybe brushing and flossing.
You got it, man. There we go.
Do that every day.
Yeah.
All right. How long should I wait to get dental implants after a tooth extraction? This is a common question.
And not very common question. You can get the implants as soon as the same day. Talk to the dentist. If you're not able to get the implant on the same day for any reason, you can get them as soon as maybe 3 months or sometime up to 6 to 9 months, depending on whether you need any type of bone regeneration or bone reconstruction or not.
Okay. All right. Hello, doctor. Is it okay for me to brush with baking soda occasionally?
Absolutely. Baking soda is definitely a great product for you to use. We do not recommend you use it on a very, very regular basis because you need a lot of fluoride to prevent cavities. So, as you said, occasionally, if you want to use it, absolutely go for it.
Okay. That's
Fantastic.
great.
Yeah.
All right. So let's see. I have another question here from a viewer. I've been experiencing some mild gum soreness for the past few months, and I'm concerned it might be related to my medications. Since I take medication for hypertension, could this be affecting my gum health? I've seen this.
Absolutely. Yeah. Why do you say? What did you say
I
that?
said I've seen that.
Tell me about
I've
that.
seen some patients who are on a specific high blood pressure medication, amlodipine. I'm not sure which one it is, but
Uh
it
huh.
causes gingival overgrowth. It might not affect everyone who has high blood pressure, but if you do have gum disease, then it more likely affects you.
Absolutely. Yeah. So anytime you take medications for high blood pressure, there are a variety of medication. Like you when you go talk to your doctor, there are like about 5 or 10 different type of medication the doctor may be prescribing you depending on the type of blood pressure you have. Most of them have a tendency to affect your gums, and what happens is we see like a lot of gum overgrowth, or we call it as a hyperplasia of the gum is what happened. So whenever we see that, and first thing first, common things are common, particularly when you have gum disease, existing gum disease. When you start yourself on the blood pressure medication, now your gums are already have like they have a lot of sliver that got stuck under the gum line because of the tartar or the gum disease you have. Now your gums are going to grow like crazy. So the first thing is, particularly when you're starting on the gum disease medication, sorry, high blood pressure medication, get your gums checked out and start the medication. And you may not have as much of a side effect on the gum. But if you do have healthy gums, and when you have these gum overgrowth from a certain medication, again, have your dentist and your PCP talk to each other, doctor talk to each other, and depending on what your dentist recommendation is, or you may just tell your physician, hey, I went to my dentist told me that this medication may be affecting my gums because he's starting to see my gums are starting to grow. Then your primary care doctor or your MD doctor should be able to change the medication to a different medication, as simple as that. So long story short, yes, the gums can the blood pressure medications can affect your gums, absolutely. Yeah.
All right. All right. Could you please let me know the average cost of a smile makeover and what treatments and services are typically included in this?
This is a long, long question. Smile makeover, right? So the smile makeover could involve evaluation for gum disease, or we call it as a people when they smile and they show a lot of lip when you smile, and we call it as a gummy smile correction surgery. Um, Whether you need gum evaluation or gummy smile correction surgery. If you need a gummy smile correction surgery, then you need veneers or crowns or maybe even some dental implants. Um, on the contrary, if you're talking about a um, like a full mouth makeover, then if you're thinking about you have some really long teeth and you have lost a bunch of bone and your teeth are feeling loose, and if you're thinking about like removing all the teeth and doing a complete rehabilitation, that can be done also. um, Depending on what you're going to need, whether you need just the gum treatment or the gummy smile correction or some veneers or crowns, or you are going to need like a full arch or a full mouth rehabilitation. These treatment can range anywhere between few $1,000s to several $1,000s. So it could be as low as $4,000 to $5,000 or a couple of $1,000s. It could be up to about 15 to 20 thousand dollars. Again, talk to the dentist, and if you happen to be in the Dallas Fort Worth area, come see us. We can help you.
Yeah.
Absolutely.
Okay. Next one. Hi, Dr. Vadivel. How many dental implants are needed to replace 3 teeth?
Um, this is a very common question. So people want to know when they need to have 3 teeth replaced, whether they need individual implants or just to or they could go a little bit less than that. So to replace 3 teeth, a minimal that you are going to need is the 2 implants. So just like a dental bridge, just like here, you see here. So this person has missing three teeth, and you're going to need two implants, one, two, to put a bridge over up on the top. But sometimes patients have a tendency to ask for, oh, I want to be able to floss, and I don't want to pass a floss under my bridge. So they say that. So can you do three implants in a row? More than likely, yes. The answer is yes. Particularly, we can do three implants in a row, mostly on the back teeth. But in the front, we do not recommend placing three implants in a row. And for the most part, but can three implants be done in a row on the front? It can be done also. So again, long story short, uh, minimum of two implants for three teeth.
Okay, we have another live question coming through.
Great, great.
Okay.
Okay.
Hello, doctor. I've noticed that my gums are bleeding while I'm flossing. Could you please let me know if this indicates a less severe or more severe form of gum disease, or if there could be another reason for the bleeding?
So, gum disease, the earliest sign of the gum disease is the bleeding. So I can tell you just based on the bleeding that you are talking about, whether you have early gum disease or you have the most severe form of gum disease. So um, you got gum disease. And the only way to tell that would be to when you come in to the office and we do a variety of exam, we do a clinical exam, and then we also take a CBCT or like a CT scan, and we should be able to tell you what type of gum disease that you have. And to answer your second part of the question, can the gum bleeding could be to a different reason? Yes, absolutely yes. And it could be sometime when patients take blood thinners and it makes your blood kind of thin. So even though you may not have gum disease, it may have a tendency to bleed, or you may have early signs of gum disease, but it is going to make it severely bleed. And the other thing that normally happens on women is what?
Um,
Pregnancy,
pregnancy.
right?
Oh,
Yeah,
yes.
pregnancy. So, and that happens, and when the women get pregnant, they may or may not have any type of gum disease because of the hormonal changes that happens, and the gums start to bleed. And also, it's not uncommon during the periods or the menstrual cycle. Women have a tendency to bleed more from the gums. So these are all the common things. Again, talk to the dentist and see whether you have gum disease or not. So if you happen to have blood thinners or pregnancy or menstrual cycle and you're bleeding, that's okay. But you don't want to ignore when you have bleeding, when you're bleeding all the time.
Very true.
Actually, I want to tell them the story. So
Okay.
this is one of the things that we normally say. Okay, when patients ask me, when we look at their gums, and they normally say, uh, "Oh, my gums don't bleed, but they only bleed when I brush my teeth." Oh, they don't bleed normally. Oh, because you are
They don't bleed
examining
when you're
with
talking?
yeah. They started bleeding. Oh, when you are measuring the gums. So this is what I normally do. Can I borrow your hand right
Yes.
here? So your skin is not bleeding now. If I'm going to touch your skin, it's going to start bleeding. Is that normal?
No, that's not normal.
That's not normal. So is it acceptable?
No, it's not acceptable.
So, why would you accept that when I touch your skin or touch your hand here, it's going to start bleeding and you won't accept that? And how could you accept that when you start to brush or floss your gums or when I start touching your gums and it is starting to bleed? Can you accept that? As simple as that. You answer your own question, right? Yeah.
All right. So, what's your view on dental probiotics? Are they really beneficial?
Um, Absolutely, yes. If you believe in it, absolutely. So there are so many probiotics, and that has been proven that the probiotics they do work. Absolutely, the probiotics are what they are talking about. The oral probiotics, or sometimes we have a tendency to call it as a dental probiotics, or even sometimes people call it as a prebiotics. What they normally say is there are, if you particularly have a gum disease and there are going to be some really bad bacteria, and the bad bacteria are going to take over the good bacteria. So we want to put some strains of good bacteria that are going to combat the bad bacteria, because those are the specific bacteria that cause damage to the gum or the bone. So these oral probiotics, they claim that we are going to put some comparable bacteria that are going to combat or going to fight against those bad bacteria that cause damage to the gums or the bone. So absolutely talk to your dentist and see whether the probiotics are an option for you, or even taking some general probiotics. And we have seen they tend to have not only to your gut health, like also to improve your oral health.
Okay, sounds good. I'm currently using Crest toothpaste for my sensitive gums, but I haven't found any relief. Can you suggest an alternative that might work for me?
So depends on what your expectation is, right? So if you have a lot of cavities, and if you have a lot of gum disease, and if you are thinking your Crest Pro Health is the magic bullet to address your cavities and address your gum disease, absolutely it is not. No matter whether you are going to use Crest or something else, it is not going to improve the condition. So my recommendation is, and I don't want to blind you by saying that, oh, a Colgate is better than Crest, or something else is better than Crest and Colgate. So if it is not working for you, there is a reason why it is not working for you. So my recommendation is, go take your toothpaste and go see your dentist and see what he or she has to recommend, or go see your periodontist to see what he or she is going to recommend, whether the Crest or Colgate or maybe Sensodyne, whatever the tooth may be. But make sure that it is going to help you or it is not going to help you, because you may have a serious problem.
Okay.
Yeah, better
Better to know
safe
than not
than
to know. Better
safe
safe than
than
sorry.
sorry, right?
Yes.
Yeah, and
Oh,
before it gets worse. Yeah, and you
definitely.
don't want to end up ignoring it, and now you're going to end up making the gum disease worse, or you may end up even having to lose your teeth. Yeah.
All right. Hi, doctor. It's been 8 days since my wisdom tooth extraction, and I'm still experiencing a lot of numbness. Is this normal?
Absolutely, it is not normal. Absolutely, it is not normal. So, I need you to go see the dentist or the surgeon, whoever extracted the teeth. I want you to go immediately see them, because having numbness after 8 days, it is not normal, and you don't want to delay this. And normally, what we say in our office is, when patients are experiencing numbness after the procedure, we tell them, hey, if you're experiencing numbness, call us immediately. Normally, we may not give any preventive medications to combat the numbness, but when they have numbness, and we can call in some medications and to combat the numbness. And in our office, we normally use two medication. One is the some kind of a steroid pack, or we also use the vitamin B complex medication. These are the two medication. The earlier you take, the better it is to promote. These are the drugs to promote your nerve health. So talk to your dentist, and it is not good. It is not okay for you to have numbness after 8 days. Talk to your dentist to see what they can do to help.
Okay. We have another live question coming through. My husband, age 46, snores a lot. I'm concerned it might be sleep apnea rather than just snoring. How can I tell the difference? He's reluctant to see a doctor about this condition.
Um, it is again not an uncommon question. A lot of people snore, right? And in medicine we say common things are common. So, and anytime we see any type of snoring, we are immediately thinking to prevent a bigger problem. And people, when they snore, we are concerned about what we call it as an inflammation. So inflammation, actually, a matter of fact, like last night, we did talk about at the continuing education course that we taught there, I told them inflammation is the common denominator for any type of disease in the mouth or any type of disease in the body, whether you take it heart disease or lung disease or cancer or pancreatitis or periodontal disease. Inflammation is the common denominator. Inflammation is the common denominator. Sleep apnea too. Sleep apnea causes inflammation. Inflammation causes sleep apnea. Snoring causes possible sleep apnea, or inflammation causes snoring. So inflammation is the common denominator. To answer your question, can you have sleep apnea? Absolutely, more than likely that people who snore, they have sleep apnea. If your husband is reluctant to go see a doctor, there are a lot of home devices. You go look it up on the internet. And the last time I looked at, like, there is an FDA approved device, and it's as simple as it's like a watch that you wear, and then it puts in a sensor in on your finger, and also there is a sensor that comes in that you put on the chest. So what it does is, and it also connects to your smartphone. Okay, so what it does is it measures the from the device to the finger and to the sensor that you put in to see whether you forget to breathe or not, and it puts everything and sends everything to your smartphone, and then it can be sent to the company that actually does the monitoring, and they actually send a report to tell you whether you have sleep apnea or not. So, to answer your question, if your husband is reluctant to go see a doctor, it's like I believe like a $99 or $79 the last time I looked at it. It could be as simple as that. So, read the reviews, and if you are going to do a home monitoring device, and if you need help, send us a text, and we are here to answer any questions. So either send us a text, go to mytoothhq.com and send us a question to our website, and either myself or my staff will be happy to answer that question for you, or go to Dental Dilemmas, go ask the question. And not just you, there are many viewers like you, they may not have thought about this question. It is going to really help them, so ask the question.
Yes, CPAP machines have come a long way. They used to be those big ones that cover your face,
Yep.
and so now just to have the little, monitor is amazing.
Yeah, so you know what? That's a good one. You mentioned that because more than likely her husband is scared because
Because
he does not want
big
to
thing on
wear
his
that
face,
big.
yeah.
And to tag along with what Amber said, with the technology now, you don't have to wear those CPAP machines. So the reason we know, we treat a lot of sleep apnea people, we treat them with like what we call it as a dental device for sleep apnea. They could be as simple as wearing something like double size of these. You wear it in the mouth, and that's just going to pretty much to treat your sleep apnea. So the best thing is to start with the sleep apnea test, and then um, just just don't worry about these big masks that you're going to wear. Don't be scared. Get the sleep apnea test, and if you're scared about going to the doctor or your sleep lab, just wear do the home testing, and talk to your doctor or talk to your dentist, and they should be able to help you.
They will, yeah.
Mm-hmm.
All right. Dr. V, I often clench my teeth. Are there any cosmetic procedures that can help with the teeth that have been worn down due to this issue?
Absolutely, yes. And depending on how much of damage you have done by clenching and grinding the teeth, which is not uncommon, and I've seen people either grinding their teeth down, or even when they wear the denture, they still wear the denture down too. So, depending on the condition, you may be able to get as simple as, what we call it as a even as simple as prepless veneers, or like a regular veneers, or you may need a crown. But because you heavily clench or grind your teeth, followed by any type of veneers or crowns that you are going to get from the dentist, and I'm sure your dentist will talk to you about wearing a night guard to prevent those crowns being worn down again. So make sure that you are going to follow through whatever your dentist is going to recommend to follow through with the night guard that you may need.
Yes. All right. I know that sugar and acidic drinks cause cavities. Could you please tell me what other foods can cause tooth cavities?
So it is a myth that people always think that, oh, only sugar and acid cause cavity. There are so many things, that could cause cavities, as simple as any type of sticky or starchy foods that you can think of, even dry foods and like raisins and candy or even bread crackers or even chips can cause. The thing is, after you eat chips or these raisins and you leave those on the teeth and on the teeth
Mhm.
or in between the teeth, and that is how these cavities happen. What about hidden sugars? It not necessarily you need to be eating a candy. It could be some hidden
Granola
sugar.
bar.
Granola,
Mm-hmm.
bingo, granola bar, yogurt, ketchup. I was going to say
I love
cereals. Yeah,
ketchup.
ketchup has sugar, ma'am,
I know.
unfortunately, right?
The best
And
ones do.
yeah, absolutely. The acidic foods that you're talking about, right? Not just a lot of acidic foods, like a lemon juice or citrus foods or even orange juice. Yeah.
Mhm.
So people have a tendency to sip it, or like
Right.
they have the fruit juice and then they go to bed and they don't brush and then they go to bed, and then that can cause some damage too. And one thing, like, do not consume the acidic food and immediately brush, because
Mm.
you're going to scrub the enamel away, so don't do that. Okay. And then
How
what
long
about
should they
even
wait?
we normally say like anywhere between about 30 to 60 minutes. Yeah.
Okay.
And then tomatoes. Tomatoes
Mm.
have a lot of acids too, right? And then people have eat a lot of pickles. Pickle have a lot of these acidic natures, and then they may damage your teeth also. So um, think of all of these foods. Don't think that only the sugar and the acid cause cavities. Any food or any carbohydrate or anything acidic can damage your teeth. So think of that. And then even sports drinks sometimes, the Gatorade, sometimes when you drink a lot of them, that they may cause some damage too. So
There's a
just
lot of
the
sugar in those as
there
well.
is a lot of sugar
Yeah.
in them as well. Yeah.
Does filling a cavity stop the decay process? Also, what measures can I take to protect the filling and the tooth itself?
Um, so the filling definitely stops the decay process, and it is going to protect the tooth, and it is going to definitely help you. Just because you got a filling now, it is not foolproof, and you still need to be following through with the brushing and the flossing and limiting the sugars and limiting the acidic food and visiting your dentist on a regular basis, and then all of these things, all of the above, are going to help. And a lot of times we talk about, like, oh, I had a filling done 10 years ago, and why am I getting a cavity again? Fillings are not foolproof, or the crowns even, they are not foolproof, and so they are going to get cavities under. So the filling, the crowns, they leak under the crown, and the fillings, they leak under the fillings, and you're going to end up having the cavity spread under, right? So make sure that you're going to follow through with the dentist and watch your diet and all of that to prevent losing your tooth.
Diet is so important.
Hmm.
Could you please explain what common dental conditions might cause bone loss?
Variety of conditions are going to cause bone loss and eventually tooth loss. We talk about not just the bone loss. We talk about um, gum loss, bone loss, and tooth loss. What are all the things that could cause the gum loss, bone loss, and the tooth loss? Periodontal disease, the gum disease, which is the most common thing, right? And the abscess or the pus pocket or any type of infections can uh, cause the tooth loss, the bone loss as well. And What about like accidents or any type of trauma? Like, you got punched in the face or you hit your face somewhere. That can cause bone loss also. And then also we call it as a tumors or cyst. These are like a sacs that it's kind of like a balloon, like a sac that happens for some unknown reason or for a genetic reason or like you're born with it. Like those can cause bone loss also. And then sometimes the misalignment of the teeth. For example, when one tooth goes like this and the other tooth grows into that, and then when it hits the other tooth, that can cause some kind of a damage of the bone too. So definitely that could cause also. And then, um, and this is one of the most common things. What can happen, what can cause, particularly in women, and osteoporosis. Anytime, as you know, you get osteoporosis, you're going to get bone loss. The osteoporosis not only affects the other parts of your body, like other parts of the bone, it also affects the bone on in your mouth. So even osteoporosis can cause damage to your teeth also. So speaking of the bone loss, what are all the periodontal disease or the gum disease? Uh, the abscess or the infection in the mouth, or these balloon-like disease, or like what we call it as a cyst or the tumor, and misaligned teeth because they hit each other, and the osteoporosis, and these are all the things that could cause uh, damage to your bone and cause bone loss. And then guess what? When the bone loss happens, and it is just not going to stop, it is going to continue and continue. So it is going to eventually make you lose your teeth. So talk to your dentist and they can definitely help you.